So thank you guys for joining us today on our Daring to Learn value-added webinar series. This is the September session. We have a great set of speakers today joining us from the Tennessee Department of Health. So we have folks from the Foodborne and Enteric Diseases program that are going to talk with us today about staying safe on the farm. And if you guys need to leave during the call, or if you miss it, this will go up on the Center for Profitable Ag's YouTube later. If this is your first time joining us on Daring to Learn, my name is Elena Boyd. I am with the UT Center for Profitable Agriculture. We're based out of Columbia, Tennessee, and this is a monthly webinar series that we put together, just touching on different topics to help folks. And I will go ahead and let our speakers introduce themselves. So Katie, I'll go ahead and kind of turn things over to you.
Yeah, all right, great, thanks. Good morning. My name is Katie Garman. I am the Foodborne and Enteric Diseases Program Director at the Tennessee Department of Health. I've been in this role for almost a decade and have been in our Foodborne and Enteric Diseases Program for 15 years and with the Health Department for almost 22 years. So I'm excited to be here today to talk to you about our work with different agritourism groups and how we hear about illnesses and outbreaks in the community, and then we'll wrap up with going through some resources that we want to make sure everyone knows about to make sure that they can mitigate the risk of illness on the farm. I'm going to pass it off to Jenny Krisnick. She is a public health fellow with the Centers for Disease Control that is assigned to Tennessee. So Jenny, do you want to go ahead and introduce yourself?
Sure. Good morning, everyone. My name is Jenny. Like Katie said, I'm a CDC Public Health Associate that is stationed here at the Tennessee Department of Health with our Food and Enteric Disease Program. So we're happy to be here.
And then Danny Ripley is an environmental health specialist with our team. Danny, do you want to introduce yourself?
Sure, thank you. Hi, I'm Danny Ripley. I'm an environmental health specialist with the Tennessee Department of Health. I work out of the Food and Enteric Diseases Program out of central office, and I cover the East Tennessee, Northeast Tennessee regions with the support we offer for outbreak investigations. Been with the Health Department for, oh goodness, is it 3 or 4 years now? Been in public health for about 20 years.
Awesome. Well, welcome to you guys. I am going to go ahead and stop screen sharing, and I'll turn that over to Katie. So you should be able to share your screen now.
Okay. It's telling me host disabled participant screen sharing.
Let's see. Try now.
Oh, there we go. Okay, can you see my screens okay?
Yes, looks good.
All right, wonderful. All right, well, again, thank you for having us. Yeah, we're going to talk today about how we can stay safe on the farm and a review of gastrointestinal diseases and tools to mitigate the spread of illness. So we'll probably talk for about 30 minutes or so. Jenny's going to kick us off and talk about the rise in agritourism and talk a little bit about the common diseases we find that are found on the farm. For this talk, we're going to specifically focus on enteric diseases, so in diseases that cause gastrointestinal illness. And then I'm going to go through how the Tennessee Department of Health is informed of illnesses and outbreaks and what our procedures are. And then Danny is going to talk with you about a really useful tool, and I hope you all take advantage and look through this tool. We have many links throughout this presentation for you to get that, but it's called the Compendium of Measures to Prevent Diseases Associated with Animals in Public Settings. So we'll briefly review that and give you links to dive into it more. And then Danny's also going to go through some steps that are outlined in the compendium on ways to minimize the risk of disease transmission. And then Jenny is going to go through, we have a new section on our website that we're continuing to build upon, but Jenny's going to go through the resources that we have there now. All right, so I'm going to kick it over to Jenny to give us a review of agritourism. And Jenny, I will drive for you here. So if you could just tell me next slide.
Sounds great.
Okay, thanks.
All right, so before we get started, we'll just do a quick review, like Katie said, of what agritourism is. So agritourism is any agricultural related activity that brings visitors to a farm, whether it's a petting zoo, farm tours, goat yoga, pick your own, wine tours and tastings, corn mazes, pumpkin patches, hay rides, weddings, you name it, whatever brings the public to the farm is kind of what we consider agricultural related. Next slide, please. So why agritourism? So agritourism is beneficial because farmers are able to market their products directly to consumers. And sometimes this can be more profitable than selling to retail or other indirect means. And consumers also really value the on-farm experiences, people that don't necessarily have farming experience. So they utilize these activities as family activities, educational opportunities, and then also to increase their confidence in buying local. And this is a rapidly growing trend that we see. Next slide, please. So with that, there are hazards when it comes to farms that customers may not be aware of. And one of those is physical injury. As friendly as an animal is, anything can happen at any time. There can be bites, kicks, scratches, spitting, you name it, anything that involves animals. The environment as well as equipment in the environment can also pose a risk to customers as well. For example, in 2014, there was a teenager that had died after being thrown off of a hayride in a farm in Maine. Next slide, please. And as far as pathogen exposure goes, all it takes is for someone to touch a contaminated object on your farm or bring it home on their shoes for them to have some sort of exposure to a pathogen. Some examples are direct animal contact and as well as indirect contact, like I said, touching contaminated products or surfaces. Next slide, please. So next, we're going to go over some common diseases found in farm animals. Next slide. So as you can see here in this table, there are many different types of bacteria, parasites, fungi, and viruses that can live on a farm, specifically involving animals. So some examples can include Campylobacter, Salmonella, E. coli, Cryptosporidium, etc. Next slide, please. So just because animals look healthy doesn't necessarily mean that they are free of concern when it comes to the transmission of diseases. Healthy looking animals can still make people sick. And so I wanted to highlight in this table that E. coli specifically doesn't necessarily show symptoms in animals, even if they're infected. So something to consider. And then Salmonella as well, you can see that cattle may or may not have fever, diarrhea, and spontaneous abortions when infected with Salmonella. So these are things to consider. And just to reiterate that healthy looking animals can still make people sick. Next slide, please. So there are some individuals that are more at risk for developing illnesses that can result in hospitalization or even death. So at-risk individuals can include young children that are under the age of 5, elderly adults that are greater than 65 years of age, pregnant women, and then people who have weakened immune systems. Next slide, please.
I'm trying to advance it. I'm not sure why it's not advancing. Sorry about that. Okay. All right. Well, I'm going to go through the Tennessee Department of Health investigation procedures. So just as some information here, and I like to refer to this as our to-do list, but what we're seeing here is our 2023 Tennessee reportable disease list for healthcare providers. So we have over 80 diseases and conditions on this list that by law need to be reported to the health department. Some need to be reported right away, and others, there's a bit of a time lag of about a week. And many of the enteric pathogens that Jenny has mentioned and that we will discuss also are on this list and are required by law to be reported to the Tennessee Department of Health. And we conduct active surveillance on these enteric pathogens by reaching out to hospital labs and big clinical labs to ensure that these pathogens are being reported to our health department. Now, one thing that is, as far as an event that's required to be reported to the health department, are outbreaks or clusters. And so if we hear from a concerned citizen or a physician or nurse practitioner in the community that they've seen, for example, many salmonella cases come through their clinic, or they might have they were at a restaurant and many of them became sick with vomiting and diarrhea, we'll immediately spring into action and do some more investigations on those occurrences. So there's two primary ways that we do outbreak detection at the Tennessee Department of Health. First is by fielding complaints from concerned citizens or healthcare providers. And then the second way is through laboratory reporting. So the first section I'm going to talk about is our complaint reporting. So the when we get a complaint from someone in the community or from a physician, we always try to get the contact information for that particular person. And typically what we're getting here is someone who's sick, that they feel like they became sick from a certain restaurant or other food service establishment. So we want to make sure we get their contact information, when they became ill, the location that they feel like that made them sick, if they've had any companions with them, any other folks that were sick with them, or even well meal companions are important to know about too. And we want to get a meal history. And one thing we also try to do is avoid that last meal bias, because a lot of times when people think it was, the Burger King they ate 3 hours ago, it was probably something else, a couple of days ago, especially if they're experiencing lower GI issues like diarrhea. So we try to get at least a 3-day meal history to get a full picture of all the events in food service establishments that these folks went to. And this really helps us direct our next appropriate steps. So we might have to visit the facility of concern of the complainant, or maybe some other facilities that the complainant mentions. We typically will also notify our outbreak team, and then depending on the situation, we may go ahead and open an outbreak investigation. So the two different systems here, and I'm going to really talk about our centralized system. We've worked really hard in Tennessee to develop a centralized complaint system. So even, complaints that are happening in the tippy top west corner of Lake County, Tennessee, we know about at our central office, just in case there are different trends going on within that county or counties that are adjacent to that county. So we can get all of that information in one centralized location. In the past, all of our local health departments, had their own systems, and they would kind of keep that all siloed, and that data wasn't shared. But now we've gone to that centralized system so we can share all of that complaint data across the state. And we also look at non-traditional systems like social media or different discussion boards, any online reviews like Yelp, or some site crowdsourcing data. And, we do our best to monitor these. Unfortunately, a lot of these sites don't capture all the data we really need to move forward on some investigations. But if we're starting to have a problem with a particular, facility, or if people are mentioning a certain event, or a petting zoo or something like that, then we'll go on to some of these sites and see if other people are also mentioning these same exposures. Yeah, so this just goes that we to show that we're trying to take all of these complaints from our health departments, from our federal partners like the the USDA, our Department of Agriculture, and then our non-traditional platforms. If we're seeing some chatter on certain Facebook pages, or if we're seeing chatter on Yelp, we'll pull all that into our complaint system, where our outbreak team will go ahead and review that and then talk about our next steps. Okay. Sorry, it's being a little slow here. Okay, here we go. All right, so that was complaint reporting. So now what I'm going to talk to you about, I'm going to go through this graph here about how we do our outbreak detection through laboratory reports. So just let me walk you through a person's illness and how we get this information. So first, as the red box indicates, an individual is ill. And in some cases, that individual will go ahead and seek medical care. And during that medical care, the nurse practitioner, the PA, or the physician may ask for a specimen to be collected. In most of our enteric pathogens, that's going to be a stool specimen. And then when that specimen is collected, it is sent to a diagnostic laboratory, like a LabCorp or a clinical laboratory or your hospital laboratory. And if there is a positive result, then by law, all of our enteric pathogens must be submitted to our Tennessee State Public Health Lab for further characterization. So what our State Public Health Lab is able to do is they're able to look at that bacteria or that parasite and say, all right, it's this type of infect, or this type of pathogen. It has this type of DNA fingerprint, which we'll get into a bit. So they're able to look a lot more closely at these different pathogens. Now, when that is happening, when that specimen is getting sent to the lab, the providers are also talking to the health departments and reporting in electronically or through fax, or calling up the health department saying, hey, I just heard from our lab and I have a positive salmonella, or I have a positive Shiga toxin producing E. coli. So that we put that into our surveillance system, and that triggers our team to do a very extensive interview on that case to better understand their symptoms, what kind of illness they had, and also the different exposures that they had. So when I say exposures, I mean events that they went to, places they visited, and foods and water they ingested. Oops. All right. And then we're able to look at when we get the bacteria or the parasite that's sent to our state public health lab, they're able to do a lot of different testing, so we can see if some of these bacteria have the same DNA fingerprint. And if they have the same DNA fingerprint, then that's very likely that they became sick from the same source. And then this information is also sent to the Centers for Disease Control. So if there's anything nationally going on, for example, if there's contaminated lettuce that's distributed all over the Southeast, all of that data is collected at the states, then it's forwarded up to CDC, and CDC is able to see the national picture. So if you look at what we have here, this is called our burden of illness pyramid. So, and we've kind of gone through this. Someone in the population is exposed to this bacteria and they become ill, but not everyone who's exposed becomes ill. And then not everyone who's ill receives care, and then so on. And you can see as we go up this pyramid, and if we're looking at salmonella, for example, so for every one case of salmonella that's reported, another 29 are likely unreported, because either the person didn't go to their provider, or the provider didn't obtain a stool sample, which does happen. If they're not having severe diarrhea, this provider might say, all right, well, you just need to get some fluids and you'll be okay. But in a lot of cases, especially with cases with kids and elderly and those high-risk population, providers will collect that stool sample and send it to the lab. And sometimes the lab doesn't isolate the organism, or that it's not confirmed. But if you think about some of these bigger outbreaks that we've heard about across the country, where it's hundreds of people are sick from salmonella, for example, you can just times that by 29 to get a real picture of the burden. Okay, so we also do a close review of all of our cases. So we want to know if we're seeing an increase in the number of cases that we normally see in a certain county or a certain area of our state. And if we start to see that increase in a certain pathogen, we'll start investigating some more, looking at their interviews to see if there is any link, anything that these cases might have in common. And as I mentioned before, we do interviews on all these cases. So we want to know, what restaurants they've eaten at, what events have they gone to, if they've, in terms of this, of people on this call, have they gone to petting zoos? Have they participated in any agritourism events? Those are things that we look at too. I know when you think of, foodborne illness and gastrointestinal illness, you think of things that you're eating, but a lot of times you can also get these same illnesses, as Jenny has discussed, through contact with farm animals. And just to speak a little bit more on DNA fingerprinting. So this is, when that bacteria or that parasite goes to the state laboratory, we do something called whole genome sequencing. And like I said before, cases with that same DNA fingerprint are likely to have become ill from the same exposure. So from the same food item, from the same water source, or from the same, petting the same animals. And we analyze this data at least weekly, if not, especially in the summertime when we're seeing more of these pathogens, we're looking at that data, 2 or 3 times a week. And what we're able to do is we can link these illnesses with foods, environment, and animal contact. If we have a food item that also grows out the same bacteria, and we have a person who's that bacteria was in their stool, we can link those two together. And this allows us for quick detection of widely distributed products causing illness. So if we have a few folks in Tennessee that ate contaminated lettuce, and in California and in Idaho, and if they ate this and they all have the same DNA fingerprint from their illness, and they all ate the same bag lettuce where we were also able to grow out that same bacteria, we can link those all together and say that these folks became ill from eating that contaminated lettuce. Okay, so when we feel like we have an outbreak going on, we're going to re-interview our cases. And if we don't know, if people just call in and say, oh, my children and their whole class, they went to a field trip to the fair and now they all have diarrhea. Well, we're going to go ahead and interview those parents, talk to the school, and if we don't know what the pathogen is, we're going to collect stool samples, and that we all of our partners at the local health department can help facilitate that. And we're going to interview folks that are sick and also folks that are well, to see what the difference is between those people, to see what the sick did that the well people didn't. We're going to visit that implicated facility. So if it's the fair, we're going to go ahead and visit that fair. We're going to talk to the people involved at that fair. We're going to take samples of things in that environment. And we're going to, if it's a food source, we're going to conduct a trace back to figure out where that food came from, what farm that came from, or what factory or facility that food came from. And we'll analyze that data. And we're going to provide education and recommendations so this doesn't happen again. All right, so that's just a kind of a quick and dirty of how the health department responds to illnesses, either through getting complaints from the community or medical community, and also how we look at the data that's reported to us when physicians and other members of the healthcare community report getting reports of these illnesses, and laboratories across the state and across the country that are sending us in the specimens from people who are sick with these different pathogens. So Danny, I'm going to hand it off to you to talk about education and recommendations.
Perfect. And Katie, I'm going to let you continue to navigate the slides for me. Katie had mentioned this compendium of measures to prevent disease associated with animals in public settings, and this is a valuable resource. for public health officials, veterinarians, for a lot of folks out there that might be involved in the agritourism businesses. And there's a QR code there that you can access this and go in and learn much more about it. I'm going to cover some of the higher level topics in this compendium. Next slide. So what does the compendium do? Well, it provides a standardized recommendation for, oops. So, sorry about that. It provides standardized recommendations for minimizing health risks associated with animal contact settings. And why is this important? Well, if we're not following some of these basic guidelines, then we can have incidences of disease occur. Next slide, please. So one area that that's focused on is hand washing, and with hand washing, obviously hand washing is very important. It decreases the rate of illnesses when if hand washing occurs after handling animals. Next slide. And then the next topic is the facility design. And the compendium talks about the layout and how the layout can facilitate reduction in contamination with animals and the flow of persons into a facility and out of the facility, and some of the recommendations or interventions that might be in place that we'll talk about in a moment. And all of these layout designs should be designed to minimize the risk associated with animal contact or control animal contact. Katie, I'm going to pause just for a second. I'm having some computer. Okay. Sorry about that. Okay, and then finally, food contamination. Of course, food contamination is important. A lot of the pathogens, the zoonotic pathogens that we're concerned about, travel that route of oral ingestion and cause infection or illness as a result. This contamination can occur at any point during the preparation of food or the point of food production. So inadequate sanitation is certainly something that is of concern. Next slide. All right, so one main emphasis of this compendium is education. Education is the foundation for preventing zoonotic diseases. And regardless of how educated the staff may be, if the participants or the visitors aren't educated in the risks associated with handling animals or touching animals, then it's going to not be nearly as effective. So education and providing educational material, messaging before entering the exhibit is important. This messaging should be very plain and easy to understand. Also consider multiple languages depending on the types of customers that may enter. And the type of messaging can be things such as signs, stickers, handouts, or even just verbal instruction is certainly adequate. Next slide, please. And the facilities should have assigned staff members who provide this education, but also provide some oversight in terms of interactions with the participants and the animals. Things to avoid would be, of course, no food or drinks near the animals, no interactions with newborn or animals that are in labor, avoiding interactions with sick or aggressive animals, and avoiding playing or sitting in the areas where there might be manure or other types of contamination. And that's something that staff can oversee or be monitoring through this process to help ensure that some of these basic activities are adhered to. And staff can utilize can be utilized also for reporting any process injury or exposure reports as well. Next slide. Also, staff or facilities should educate participants on the high-risk individuals that might need to take additional precautions or even avoid animal exhibits, those groups being the immunocompromised or the very young as well. So there's always those concerns that should be emphasized as well. Next slide. All right, so the next part of the compendium that focuses on facility design. And it's recommended that the facilities be designed into 3 different area types to help control access to animals. And those types are non-animal areas. These are areas where there shouldn't be any animals, except for perhaps service animals. And then there's the transition areas, that's the entry or exit areas to the animal areas. And then, of course, the animal areas, that's where the animals would be. Ideally, you have a one-way flow of visitors with a separate entrance and a separate exit points. And at those exit points, it should be designed that there are boundaries. There should be hand sinks, hand signs, staff present to encourage hand washing. And the hand washing facilities should also accommodate all potential visitors, whether it be children or folks with any type of disabilities. And also the animal areas themselves, you see design 2 there, you have two different designs, and the second design has a entrance and exit at the same. And this is a typical setup where animal contact would not be expected. So just viewing of animals in these types of settings. And then also in these settings, additional boundaries or barriers, space barriers or multiple double barriers might be appropriate. So children or people can't reach in and contaminate themselves by maybe touching the other barrier that's actually holding the animal that could be contaminated, or touching the animal itself. And also these in thinking of design of these areas, we want to be mindful of the animal waste and tools to remove or to clean, making sure that folks don't have access to those areas. Next slide. All right, so and then feed and water sources should be limited as well. There should be limited access or no access to the public. And in some instances, I'm not familiar with this, but I've read a little bit about some types of operations that might use an edible type scoop to feed animals, and that might be discouraged because children might tend to think it could be an ice cream cone and eat it. So anything that would discourage consumption of food or eating something from a child would be recommended in these settings. All right, next slide. And then cleaning and disinfection, of course, is important. Cleaning should occur when animals aren't present, when the animals are removed. It should include the flooring or railing or anything in contact with the animal. The types of chemicals used, typically with sanitizer agents, we recommend bleach or quaternary ammonium compounds, but be sure that they're used within the label recommendations. And having a contact time is very important, up to or greater than 10-minute contact time before that chemical is removed is important, so that you have an appropriate reaction with any bacteria that might be present. And then, of course, providing ventilation. It's important that we don't stir up dust. In a lot of these settings, you might see large fans blowing air and just to facilitate airflow, and we just want to make sure that any type of dried fecal material isn't getting unnecessarily moved around in these environments. Next slide. So just a recap, you've got 2 different designs here, and the first design is ideal, where we have a separate entry and a separate exit, ensuring that there's appropriate barriers inside, and also that the folks, the participants are monitored by the employees to ensure that they're not doing anything that would facilitate contamination. And then immediately upon exiting those animal areas, having the ability to wash hands, to educate folks on hand washing and ensure that that takes place. And not have hand washing stations. I know we had an event a year or so ago where the hand washing stations were a long way from the petting area, and that gives more opportunity for participants to contaminate their clothes or other things or touch their mouth, etc., while they're walking this pretty long trek back to the hand wash station. So having that hand wash station immediately following the animal area would be preferred. All right, so and avoiding food contamination is certainly important. Visitors should not eat or drink, smoke, or place their hands in their mouth, or use bottles or pacifiers while in the animal area. Again, referencing one of the events that we were involved in, there was a child that was fiddling with their loose tooth. Little things like that could facilitate, getting a pathogen from petting the animal back into the mouth, and should be discouraged. Of course, the things like pacifiers and bottles for small children should not be used in these areas. Next slide, please. And with that, children should always be supervised in the presence of animals and animal waste. Of course, kids can be challenging to keep track of, and there always needs to be adult supervision when children are handling or around animals. And next slide. And then, of course, proper hand hygiene. And this is something that a lot of visitors might think that sanitizer is a preferred, is better than hand washing. It's important to emphasize that using water, soap, and paper towels is the best practice to prevent zoonotic diseases. So some patrons may only want to use hand sanitizer. So it's important that that education and training is provided by the staff at the facilities. Sometimes sanitizers are just simply not effective depending on the load that's on the hands. All right, and then well, one last point here, and this is a very important point. Strollers, shoes, other things, clothing that may come in contact with contaminations should be of concern among folks. This educational part should be communicated, that if these items are touched, then hand washing should take place, so we don't have this cross contamination moving from shoe to hand back to mouth or food. And with that, I'm going to turn it back over.
So in addition to the compendium, we have also developed some resources for agritourism as it relates to Tennessee specific recommendations. So we're going to go ahead and share some of those with you now. So this first page here, you'll see the newest webpage to our Tennessee Department of Health Food and Enteric Diseases page. So this webpage is specific for agritourism and includes related materials. So we've talked about the compendium, so that's listed there, as well as some guides that we've created as well. So if you look at the QR code in the corner, that links directly to our agritourism website. Next slide, please. So this first one here is a flyer that's intended for the public that just outlines the risks that we've discussed previously associated with agritourism operations. So this includes opportunities for interaction with animals, and then also covers some food consumption as well. Next slide, please. This one's just a generic hand washing flyer or handout that can be posted near hand washing stations to remind people to wash their hands, and also the proper way to wash your hands. Next slide, please. Again, another hand washing guide that can be utilized. This one's more in depth and can be used in spaces where employees need to wash their hands as well. Next slide, please. We've also included a safety checklist for owners and operators that are either starting up their business or looking to improve overall safety of their operations. And this is a good one to just print out and kind of look through and check off as you go. Next slide, please. And then lastly, we have a comprehensive guide that takes the recommendations that we have discussed here in this presentation, as well as the compendium that was referenced, and puts all of them together in one document for Tennessee's specific recommendations. Next slide, please. And that's all we have. So the top QR code is for the compendium that we've been referencing throughout this presentation. And the bottom QR code is for our agritourism page if you missed it the first time. Thanks.
Awesome. Thank you guys. So if any of you were at our center's biosafety safari that we held in April, this compendium, you actually received a copy of that at the event. It's a really great resource. We referenced it in April. We've referenced it in other events since. So definitely encourage you, if you've not seen that, to scan that QR code and get a copy of it. And if any of you guys have any questions for the folks from the Department of Health, you should be able to raise your hand or send something out in the chat. So if you guys have any questions, now's the time to ask them. And I don't see anyone with hands raised, so if not, no worries. I will get their contact info to you guys, as well as a copy of the slides. So if you don't have a question right now and you come up with one later, we can help get you an answer. Awesome. I will go ahead and share this again. So again, thank you guys. Thank you, Katie, Jenny, and Danny for your presentation. It was fantastic, and you guys did good. For those, the rest of you guys on the presentation, if you've been on one of our Daring to Learn sessions before, you know about our attendance survey. So this QR code that we have up on the screen, especially if you are watching this webinar for TAEP credit, be sure to fill that out, and I'll get an email out to you guys once this gets up on our YouTube page. So if nobody has anything, oh, we got something in the... Oh, awesome. You guys got a thank you in the chat box there. So, all right. Well, if we don't have anything else from anyone else, I will go ahead. I'm going to end the recording, and thank you guys again for being with us today.
Yeah, thanks for the opportunity. We appreciate it.
Yeah. All right.
Thanks. Bye-bye.
Thanks, guys.
All right. Thank you all. Bye-bye.